Okay, folks, let's get started. Thank you so much, DJ Eliza. We are going to get started. My name is Gerard Kaingo. I am the Executive Director for the Physician Assistant Leadership and Learning Academy here at the University of Maryland, Baltimore. I'm extremely happy and delighted to see you all. So welcome to the University of Maryland, Baltimore. And also welcome for those folks who are on the sky. I know there's a couple of folks who are joining this celebration via Zoom. So we just want to say welcome to you all. This is a very special day for us. This is our second annual PA Week celebration at this campus, and we have a lot to celebrate here in Maryland. For some of you who are very familiar with the history of PA profession in Maryland, we have been making huge strides. We started with 1 or 2 PA programs back in the 1970s, and now we are over, I think we have 6 programs already. The number of PAs in the state has increased tremendously, and I would be surprised if we are not about either 4,000, 5,000 there. So we have seen a lot of growth here in Maryland. The scope of practice has also been improving over time. Thank you to all who have been lobbying and advocating. So there's a lot to celebrate. PALLA is extremely happy to collaborate with the Maryland Academy of PAs to make this event happen. So to our colleagues from the Maryland Academy of PAs, I just want to thank you for your collaboration. It would be, I'll be deceiving myself or even cheating myself if I don't acknowledge some of the amazing successes that we have had in the profession here in Maryland. Most importantly, dear to my heart, is the recent successes in our accreditation. For the first time in 10 years, we have all programs in Maryland in good standing. So I just want to... That's huge. And I want to take this opportunity very quickly to acknowledge the PA program directors and the PA program faculty and the leadership and deans who have really been working so hard to ensure that the quality of PA education in Maryland is outstanding. So I know I have a few folks here. I'm going to start with the University of Maryland Eastern Shore. So just, to acknowledge the work that you guys have been doing to put your PA program back to great shape.
Everyone looking back on the journey that's you and Sean have just been a great support system.
Thank you so much. It takes a village. In no particular order, I also want to acknowledge our sister program on the west side of Maryland, University of Frostburg PA program. Thank you so much, Rose. I don't know that we have somebody representing Towson, but Towson has just received the good news as well. Hey, Towson University. Thank you. We really appreciate all the great work that's going in there. I know that Dean Proudfield is on Zoom. So Dean Proudfield, wherever you are, we just want to thank you to PA education over the last couple of years is inspiring. We have University of Notre Dame. I don't know, there's somebody here from the University of Notre Dame. I know they have just, about 3 years ago, they received their provisional accreditation, and they're now working through those stages. Mount St. Mary PA program. Today, they're unable to be here because they're actually meeting with their admitted students. So you can see the momentum that's growing. So with those few remarks, again, welcome to PA Week. The theme for today is bridging the gap, improving access. We want to see as many PAs in the state, in almost all specialties, in all locations, really adding value to patient care and as a solution to some of the problems we have. With those few remarks, now it's my greatest pleasure to welcome or invite the program director of our program here at UMB, the host program for today, Professor Colin Ohms.
Thank you so much, Gerald. Good afternoon, everyone, and welcome to the University of Maryland, Baltimore. It's wonderful to see so many familiar faces and so many new ones as we come together for our PA Week luncheon, celebrating this year's theme, Bridging the Gap, PA's Advancing Access in a Changing Healthcare Landscape. As program director of UMB PA program, it's truly an honor to help open today's event. PA Week is always one of my favorite times of the year because it gives us the chance to celebrate who we are as a profession, to reflect on how far we've come, the impact we're making, and the difference we continue to make for patients every day. When we talk about bridging the gap, we're really talking about the heart of what it means to be a PA, expanding access to care, advocating for our patients, and mentoring the next generation of PA providers. PAs step up wherever they're needed, meeting patients where they are and ensuring compassionate, high-quality care is always within reach. I'd like to extend a very warm welcome to all of our students, MAPA, friends, family, alumni, faculty, staff, community partners, and Maryland PA programs, and offer congratulations as well to the programs UMES, Frostburg, Towson on their recent wonderful news of their accreditation. This is really a really positive year for PA education in Maryland. Heartfelt thank you to PALLA for putting on today's luncheon and to MAPA for your continued partnership and advocacy across the state. Today's program is all about connection, celebration, and inspiration. I hope you'll take the time to enjoy the conversations, honor the incredible work of our colleagues, and feel proud of the vital role PAs play in shaping the future of healthcare. Thank you for being here and happy PA Week 2025.
And my name is Jamie King. I'm the Director of Strategic Partnerships and Advocacy with PALLA. I'm thrilled to be here and so amazing to see so many familiar faces and new faces in the audience. It is with my greatest pleasure to introduce Robin Elliott, MAPA's lobbyist. I'll have her come up and say a few words. She'll talk a little bit more about the great things that she's been working on with MAPA.
Right. I can see most of you. This is always the challenge when I'm at a podium. So hello, everyone. As you heard, I'm Robin Elliott. I have been the lobbyist for the Maryland Academy of Physician Assistants for, I think, just over 1 year. So thank you for throwing a party for me for my 1-year anniversary. And I am really pleased to be here today because we have done a lot of important work in the last year, and I can't imagine a more critical time to continue to do this work in the next 2 to 5 years. So I think the theme is the changing healthcare landscape. I can't say enough that I think the word changing, we all use it, is an understatement of the year. It is just massive changes. So I wanted to start out by just seeing how many people in the room have written to a legislator, been to Annapolis, done something connected to advocacy. I see a lot of hands. I recognize a lot of people. That's wonderful. I want to say something about working on the state level, because I know actually literally nothing is happening on the congressional level right now, like nothing. The wonderful thing about working on a state level is that one person, one organization, one small group of dedicated people can actually do something. And that is a very, very invigorating thing to realize when you first start on the advocacy journey. Annapolis itself, many of you may have been there. It's tiny. The legislative complex itself is like 2 blocks. There are 188 legislators. What it really is, it is a small town in and of itself. And why I say this is because one person, one organization, one group of committed people operating in an environment that is small can make a tremendous difference. And that's been the history of advocacy with physician assistants. Just a bit about our accomplishments. This past session, I had the privilege of working on the final year of the journey to really transform the way that physician assistants are licensed and recognized under the law of Maryland as being part of the healthcare system. As I think probably everyone knows, we were able to transform the framework from a delegation agreement to a collaborative agreement. And there are a lot of really good process things that come with that. Like it's going to be easier, and I think they've already started to take effect, easier to get licensed, easier to enter into practice, less hurdles, more respect for the profession, all good things, more access for patients. I really wanted to focus on the words, delegation agreement and collaboration agreement, because really part of the work of advocacy, the words really matter. And so we have all those provisions that improve things in law, but framing who physician assistants are and the importance in the healthcare system, words matter. And so that one change itself is a tremendous victory and sets us up for more victories, I think, in the not so distant future. So now on to the changing healthcare landscape. I am going to talk about some bad news that we probably already know about, but I'm only going to talk about that so we can also talk about the good news. So what can we expect in Maryland? We actually don't know. And usually we have a clear framework of going into session, what would be the major bills, what was going to happen with the budget. It's not like we know everything, but we'd have a clear path. I've been doing this for 25 years. I started off, actually my background's healthcare finance, so I used to work in a hospital system. And then I went into working for state agencies. I was director of governmental affairs for our state health department. I have never seen a session, this is probably my 25th, where we knew so little about what was going to happen. So, of course, the top line is we do not know what's going to happen with federal funding and specifically Medicaid. We know that we are at risk for losing 275,000 people their coverage from Medicaid. And that's a combination of immigration status, the redetermination requirements that HR 1 has, as well as the work requirements. We just don't know. We also don't know the impact of what's happening federally and with the shutdown on Maryland's economy. I'm sure all of us here, some of us may be federal employees, and if we're not, we all know federal employees who are impacted by what has been happening, and that affects the state economy. Some interesting things are going on. There is the AHEAD model, which we all know about and is in flux. And that is Maryland's unique system for regulating the hospital system. Oops. And then that flows down to sort of affecting all parts of healthcare. There's a really interesting opportunity on the table right now. All states are going to be able to get a rural health transformation grant. That was part of HR 1. What is really interesting about that rural health transformation grant and the request for proposal is very, very long. But in that proposal, it asks states to do some innovative work, and it lays out some options for those innovations. And guess what? Physician assistants are directly lifted up as a potential priority area for the states. Yeah. I think what we're seeing is recognition that healthcare can only function, that we can only get better if our healthcare practitioners are able to work at the top of their licenses. And what I think we saw in that rural health transformation grant is the tremendous potential that not only Maryland, but the entire country has in really rethinking and being innovative in how physician assistants are integrated into the healthcare system and recognizing all the good work that you can do in all the different settings, in all the different types of clinical practice. I think that is tremendous opportunity. We also know that there is incredible work that's going to happen on primary care transformation. There's already been work in progress. But when we think of what is about to happen in terms of Medicaid, there is an increased recognition that we need to do more with primary care. That it is, we may have many, many people who are uninsured. And so that the state needs to do something about providing primary care services in some type of coverage program. I don't know what it will look like, but I'm convinced we'll have one in Maryland, because Maryland has been very, very committed to lowering the rate of uninsured. And that we need primary care in order to keep people healthier, especially if they don't have insurance, because we can't afford for them to then go to hospitals and other more complicated sets of care. So what does that mean? When I think of PAs, this means that when we think about practitioners working at the top of their license, I think we have an incredible opportunity. We've got the Rural Health Transformation Grant. We've got the recent victories that PAs have had in Maryland with the Collaborative Practice Agreement. We've got an increased focus on primary care, and we don't have any money, right? So what do we do when we don't have any money? We figure out how to do more with what we already have. And that is where I think advocacy comes in for physician assistants. We were already kind of doing great, and we are still doing great. But now, given the sort of environment, I think part of our framework is we don't have any money. We can't magically grow a bunch of new practitioners, but I was really happy to hear the news about PA programs. Congratulations. We need to do better with what we have. You all have been tremendously effective in advocating. I've been so honored to work with you. Whenever I've been working with a physician assistant and telling their story in Annapolis, you all have unique and different stories. You work in every setting. You've had interesting pathways to get to where you are, and you all share the same commitment to patient access. So we have tremendous potential, I think, in Maryland. A little bit about what we do know that's going to happen next session, even though we don't know everything, especially on the budget. We do know that we are bringing back a bill that kind of got tried out, and sometimes bills take more than 1 year, and that is called the Physician Assistant Parity Bill. And the idea is recognizing in the law where there are physicians, nurse practitioners, sometimes it may be social workers, sometimes it may be psychologists who have the authority to either order or sign or somehow authorize within the healthcare system that PA should be there each and every time. So we have that bill. We're super excited. We have been working very hard with many other stakeholders, hospitals, the health department, really kind of lifting up that now is the time, going back to this sort of theme, this mantra. We don't have a lot of money to put in new programs in the budget. Now is the perfect time to take a look and figure out how we can do things better. So that is just a tremendous opportunity. I did also want to say a few words about all the different types of physician assistants that are here today. I see some very experienced physician assistants. I've met both of you, probably because I was trying along with my partner in crime, where's Jen? There's Jen, to recruit people to come down and testify, talk to legislators. So I've met many of you, and it's been delightful to see that connection that you all either already had or just forged new connections, and bringing that deep experience that you've had in the healthcare system, in all those experiences, which worked, which experiences didn't, how to improve things. So I wanted to thank all the very experienced physician assistants who have been there. Thank you also, to our faculty members, our director programs, all of our education community. One of the things that was so impactful on the bill about collaborative practice is to hear from the education community saying, we're doing all this tremendous work to bring up the new generation of physician assistants, and we need to make sure that they can get jobs and that they can meaningfully contribute to their communities in a way that allows them to use the things they actually just learned. And hearing that from educators was tremendously powerful. Now I want to talk about the students, because there are many students in the room. I think there's some online. And so one of the things I just wanted to let all the students know is I've never met a legislator who doesn't love meeting students. They love it. They want to hear all about like what school you're going to. They want to figure out like if any of their kids or any of their neighbor kids go to school with you. They just love students and they really, really love connecting to students. And so I think it's great that you're here and really want to kind of encourage as much student involvement in advocacy as possible. So, and there's so many different ways to do that. With that, it's just the problem with time and not wearing a watch anymore. I think I'm getting pretty close to time. But I really wanted to just leave you again. I'm going to circle back to that observation that Annapolis is really a small town. Why everyone here is important to the advocacy process is I've seen so many times, whether it is someone coming down to testify at hearings, or you're there for an advocacy day, or we have a Zoom meeting with the legislator, that you run into people you know. You realize you've had that personal connection. Sometimes you've treated a family member. Sometimes you've treated the legislator. Sometimes the legislator has a PA in their family. That's also super common. That small town quality of working on the state level is what makes advocacy very effective and also personally rewarding. So I just want to encourage and also demystify advocacy, and that it really is about that personal connection. It is a connection that I know when you are treating your patients, you make a clinical connection with your patients. When you are lobbying and advocating, you are making a connection to that legislator, and it's a real connection. And those connections truly result in change. So thank you so much for all of you that came out for the collaborative agreement, the Physician PA Modernization Act. We had a fancy name to it. So thank you very much for coming out. And I'm really, really excited about what we can do next, because that was a big, big lift. And we got it done. And now it's cleared the way for all the other things that I know are on the list to do. We know one of them, it's the PA Parity Act. We know there are many, many others. And so we are really just very excited to do that work. And thank you for having me. And I think I'm on a panel soon, in which we have some more discussion. So thank you so much. Yes. Thank you.
Thank you, Robin, for that insightful overview. Now I am happy to announce our keynote speaker, Dr. Jennifer Beauchamp. She's a physician assistant, educator, and healthcare leader. She currently serves as the director of assessment and assistant professor in the Department of PA Studies at George Washington University, where she leads curricular innovation and programmatic evaluation aligned with ARC-PA accreditation standards. With over 15 years of clinical experience spanning hospital medicine, orthopedics, obstetrics, and gynecology, Dr. Beauchamp has blended hands-on patient care and transformative leadership in quality improvement and health system redesign. Dr. Beauchamp has her Doctor of Health Science from A.T. Still University, Masters of Medical Science from St. Francis University, and a physician assistant certificate from Anne Arundel Community College. Her scholarly contributions include over a dozen peer-reviewed publications and presentations on healthcare quality, opioid stewardship, surgical outcomes, and COVID-19. She also serves on multiple academic and professional committees and is committed mentor to future PA leaders. She is the recipient of the inaugural PALLA 2024 James Cawley Award for Excellence in the PA Profession. Yeah. And recently appointed as a commissioner for the ARC-PA newly formed post-professional PA doctorate subcommission. Passionate advocate for the PA profession, Dr. Beauchamp is past president and current legislative director of the Maryland Academy of PAs, where she led the authorship in the successful passage of the PA Modernization Act that Robin was just speaking to. Yes. This landmark legislative achievement advances PA practice, autonomy, and healthcare access in Maryland. Her advocacy efforts have shaped workforce policy at the state level and inspired legislative changes across the profession. My pleasure, Dr. Beauchamp.
Well, thank you all for having me today. When I listened to that bio, it actually is just kind of like part of how I feel my role as being a PA really is. And so that's really what I wanted to kind of just talk to you about. But first, I wanted to really thank Dean Wong, Dr. Kango, Dr. King, and the whole PALLA team for the invitation to speak with you all today. I'm really glad that we have representation from the PA programs. Thank you to Robin Elliott. She really just kind of like set me up for my talk, and really excited to have the students both here and hopefully on Zoom that I have an audience with, because that's really my passion. And what I love to do is to work with students and really hopefully inspire their own passion for leadership and advocacy. I really wanted to also reiterate that words matter, right? What we do, what we say, how we interact really impacts everything that kind of falls down the line. And I've always been so impressed anytime I've worked with students, whether it's precepting or interview days or anything. The people that self-select for this profession are the most fantastic, dynamic humans on the earth. They really are passionate, caring, that they truly inspire me every day, that we can, in all of the rest of the world's chaos, is that we have a profession that is solid in terms of its vision and mission to help people and to move healthcare forward. So with that, again, Robin really set me up with related to relationships and connections. So everything that we've been taught in PA school is how to take care of patients, right? How do we create that experience? How do we elicit a history, our HPI, go through our review of systems, our physical exam findings? How do we make those connections with patients so that we can make those appropriate diagnoses and get us to where we need to go, so that we can order the right tests, so that we can come up with an assessment and plan that's appropriate for the patient? And then how do we make those communications, right? So advocacy is just that. Okay. Every connection that you make with a patient, every connection that you make with a physician, with a nurse, with a scrub tech, that's advocacy. That is what you do on an everyday basis. Those connections that you're making is advocacy, right? Because when you're in a meeting, when you're following up and you say, oh, the PA Barnett over here, she made a great catch, right? She got that diagnosis. Or, we've got PA Park over here. She really came through with a great improvement idea that streamlined, our process in the emergency room, right? So every time we make those connections, whether it be with a patient, whether it be with an administrator, whether it be with someone that we work with, that's advocacy. I've got Robin here. She makes those connections for me and says, hey, talk to, Chair Beidel, or put this presentation on, or do something like that. And all I have to do is speak to the wonderful work that we do as PAs every day, and it sells, right? It's easy. Okay. We just have to say, oh, you know what? I just met with Senator Carrozza 2 weeks ago, and she has a family member in a hospital saying she's being taken care of by a PA. She's got the best care, right? That's advocacy. And that PA has no idea who she is, and who that patient is, right? And who she's talking to. All she's doing is her job, right? So that's why I think it's so important that advocacy, it's great when we all show up and we're in Annapolis and we're wearing our white coats and we're talking to legislators about, what the PA profession does and all of those things. But I really want to impart to you how important it is that what we do every day matters, okay? Those connections that we're making, we don't know who those people are and who they connect with, right? But they do. They know who they connect with, right? They talk to their family members and say, I had a really great experience with this PA. She took the time, or they took the time with me to explain what my diagnosis was. And I understood it this time. It really made sense to me, right? And that means that they're going to follow through on all those recommendations that you're going to say, because, it's one thing to make the recommendations. It's another thing for the patient to actually follow through with it, to actually go to PT or to actually take their medication the way they're supposed to, right? And the way that we communicate that is so important, because that means that we're making a difference in those people's lives to be able to create a better community, right? And then they say, hey, in terms of primary care, I'm going to keep using Dr. Barnett as an example because she's right here. Dr. Barnett's great primary care. You should go, if you need someone, she'll take care of you, right? That's what advocacy is, okay? So on that note, it's so important that you get involved at every single level of where you are, whether it's joining a committee, whether it's seeing something wrong. PAs are great problem solvers. How many times do you make that connection? Even the students, I bet, on your rotations, you're like, I know what that is, right? Sometimes even before the docs or whatever, like, I get that. I know what that is, right? I see that presentation. So we're problem solvers, and we can see how the system works, and we can see how to improve it. So that's advocacy. That's working within your own environment and within your health system to say, I can help. I can fix this. I know how to work with, Dr. So-and-so or nurse so-and-so and make this process better, right? And with that, they're going to say, hey, you know what? I really love Dr. Barnett on this committee because she has great insight to how this works, right? And then once you get on that committee, then you're up with hospital leadership. They're like, oh, you know what? We have this issue with a head and we're wondering about patient surveys, right? How do we improve patient satisfaction? How do we improve quality? How do we reduce hospital-acquired infections, or, all the CAUTIs and the CLAPSIs and all of the other reportable things that we have to do in these models, right? We can talk about all of these like giant processes, but what does it come down to? It comes down to our interactions with those patients and our everyday work, right? Whether it's making sure that fully comes out in time and reducing CAUTIs, right? It's making sure that little antibiotic disc goes on your, central line to make sure that you don't get a central line infection, right? It's following through and making sure these processes work. It's taking the time with the patient, sitting down and explaining their assessment and plan, their follow-up. That's your patient satisfaction scores, right? That all leads up to those, big level CMS models and all of those other things that we talk about in an esoteric way that nobody really knows how they calculate those things, right? But it doesn't matter, because every time that you have an interaction with a patient and when you're doing your regular job, you are an advocate for our profession and an advocate for your patients and the community that you're working in. So again, my job as legislative director is pretty easy, because I have all of these great PAs that I'm working with and standing with. And I know that if I have anything that I need, and I say, Robin says, you know what, we need hospital systems, I got you, right? I've got a PA in this leadership role at University of Maryland. I've got a PA here in a leadership role at Johns Hopkins. I've got a PA, a leadership role at, MedStar, right? and they can really talk to their people and their PAs to get that movement, and they can explain to us where those issues are, right? Because I hear it all the time. PAs are problem solvers. They know what needs to be fixed and how to fix it, right? So it's just about getting yourselves embedded into the processes so that everybody recognizes that. And that's where I'm imploring you to get your advocacy is to get involved in the system level of where you are so that we can make these processes better, right? Nurses do this, nurses do this great, right? If anybody's ever been to a committee and you tell me there's not a nurse, you're not on the right committee, okay? They do this very, very well, and it's embedded into their education. And we, I think as PAs, do an amazing job of training PAs to be the best clinicians that we can be, right? We really need to be able to train PAs to be embedded in the healthcare system so that we make sure that we're have a seat at the table and that we're the leaders of the future and we're making decisions for ourselves, right? And that's why words matter. And that's why the collaborative agreement is so important, right? Because a few years ago when one of my close friends and colleagues suggested that I run for president of MAPPA. I was like in the middle of my doctorate program and I was like, oh, I don't know about this. This makes me a little nervous. She's like, oh, you got it. You can take care of it. And I was like, okay. So, rolling along, learning the ropes, all of that stuff. And then I get a letter from the Board of Physicians that says, we're updating the regulations and we're interpreting supervision to mean on-site supervision. We're interpreting delegation to mean that the physician is going to tell you exactly what you need to do, right? And I was like, hold on here, right? That's not necessarily the intent of what the law is, right? So in that mind, I was like, wait a second, we need to change the law because words matter, right? So it's an iterative process, took us 3 years to get there. Like Robin says, it doesn't all happen at one time. So we submitted a modernization act that was 72 pages, a little overwhelming for folks. So then the following year, we submitted both the modernization and the parity act, also probably a little too much at that time. And then finally, with Robin's help, we were able to get the modernization, which included collaboration with your physician, no more delegation agreements. You have practice agreements at the practice level. You're writing prescriptions under your own name. And you have exemptions for hospital systems, federally qualified health centers, and acute care surgery centers for advanced duties, and for PAs that are practicing with more than 7,000 hours of clinical practice. So with that, that's a great foundation for us to really be able to participate in grants where we're working at the highest extent that we can practice here in Maryland. And that's why the Parity Act is so important, that we're able to work with our NP colleagues and that are doing the same jobs, that we're able to do the same things that they're able to do. We're able to sign the forms. We're able to do the things that we're already doing, right? And again, although it took a couple iterations, the Modernization Act really wasn't modernization because all it was recognizing what we were already doing in regular everyday practice, right? So it allows us and sets the foundation for us to be able to move forward and make those additional changes that we need to make. And again, all that happens because of the leadership that everyone does on an everyday basis and all of the relationships that you have with your patients and with the community. So thank you for all that you do. But if I can implore you, please join committees and be involved in all of your hospital systems at the ground level. Thank you.
Thank you, Dr. Beauchamp. That was fantastic and absolutely something that I've seen in my practice years and years. Having PAs at the table is an incredible way to advance our message and what we do and advocacy. Thank you. To deepen this conversation, we'll now transition to a fireside chat featuring the voices leading advocacy in both state and national levels with our moderator, our esteemed dean, Dr. Kenneth Wong.
I don't want to mess up the system here. Thank you. Awesome. Thanks. But I feel it's a little easier to be engaged if I'm not standing behind you and lurking. So heard a lot of good things about advocacy and about the importance of relationships. So I wanted to pose a question to all of you. Where do we go from here? So what are some of the things that you see as kind of immediate next horizon steps? And then we'll start there, and then I'll ask sort of my next question about a different area of advocacy and change. So.
Thank you for the opportunity to sit on the panel and to answer the question. The great news is that we are always in the middle of a story. We're not at the beginning, we're not at the end of the story. So there are always places to move on. And at the national level, we have a full suite of next steps for PA modernization. We're working very hard with every state to be able to provide you the resources you need, the people you need, the communications you need to be able to get to those next steps. It really comes down to identifying what are the barriers to getting excellent care for everyone in your community, and that's the next place.
Hi. So I agree, Dr. Bunnell. I think that, again, like I was saying, we do an excellent job in providing patient care, but where I think we really need more advocacy and more representation is those connections and connecting the dots, right? So how do we make PAs be kind of the primary care? How do we make it so that PAs are the go-to people on committees? How do we make sure that we have a voice at the table when these larger decisions are being made at the state and national level? I really think that that's where we need to take that. Again, nursing and physicians do a great job at this. And I really see that PAs need to be that next pushing forward to make sure that when they say, hey, we need to create access to primary care, that it's not just talking to nurses and physicians, and that PAs are included in that conversation.
Okay.
I'm going to build on what the prior speakers say. In state government, our legislature meets for 90 days. It's pretty much impossible to solve complicated problems in 90 days. And so more and more I've seen the Maryland General Assembly push out decision-making and thinking about solutions to stakeholder work groups. Sometimes they're called commissions, sometimes they're called task forces, sometimes they're called collaboratives, all sorts of things. This is really where the rubber meets the road in terms of policy, because policy is just too complicated to figure out in 90 days. What I've noticed is that health professions that are very, very active in all of those policy issues that affect patient access, whether it is the problem with people not getting immunizations that they need, whether it is children, there's been a drop of children who are getting preventative dental services. So can we think more about how to fix that in school-based settings? There are literally dozens of these groups created each legislative session. Having a PA presence, maybe not on literally every committee, that would be a lot, but on many of them does two things. First, it gets that PA perspective into solving or coming up with solutions. Do we ever totally solve a problem? We sort of make progress, I think. It gets that very, very important perspective that I think Jen was mentioning when she was speaking a few moments ago. The second thing it does is legislators and then all the other sort of groups in Annapolis that are important really affiliate the Health Professional Association with being colleagues in the trenches trying to solve these healthcare access problems. So when you come to the table with what is a licensure issue, a scope issue, a very annoying, outdated requirement for the PA profession, when you come to the table, the thought is this is our partner in this primary care issue. This is our partner in the vaccination issue. That really, really see health professional associations engaged in that broader policy work. And it makes it a lot easier when you go and what you want to fix that healthcare profession specific thing that's usually left over from 20 years ago and no longer makes any sense. So I think that is really kind of taking it to the next level. One of the things that physician assistants already have started to do, but kind of thinking about doing that more.
So let me follow up on that. So are these commissions or these work groups standing things that exist all the time? Or is this, I'm creating this for a special purpose, it has a year's or 9 months worth of steam, and then it's going to report back to me at the next legislative session? So is there continuity that we can achieve in some of these goals?
So they usually are created by legislation or at the request of a very powerful legislator who doesn't need a bill for people to do what they say. And it's usually for time limited. Typically 1 to 2 years. But what's really interesting is they all kind of have a similar flow. Mm-hmm. And so once you get experience on one committee, and even though it ends, you learn how to be effective on the next one. Like how to get your stuff on the agenda, whether or not you want to be chair or vice chair, how to utilize kind of the state agency contacts. So while the subject matter and the actual committee could change because they have a limited lifespan, the skills in the relationship transcend that.
Should we be chair? I mean, do you advocate for that, or is that a smart move?
To be chair?
Yeah, to be chair for the committee.
Yes, I think it's a great move. Okay. I also think it's really powerful to be co-chairs. So, for example, let's say there's a committee on improving access to primary care in some way. And I have been co-chairs of many committees, so that's why I say this. Okay. If you are a co-chair and you are with, let's say, a physician colleague or a hospital colleague, as co-chairs, you have responsibility for getting a productive report product And that really, really builds relationships if you are in leadership together. So I think it's actually even more powerful to be a co-chair than a chair, even though co-chair sounds maybe slightly less important, but it is really, really a great opportunity.
All right. So from your perspective, having worked on these kinds of organizations and for some of the students in our group, is it like group work when you're a student where, some of the people are pulling all the weight and some of the people are like, they're kind of slacking, hanging back, but they're getting some credit anyway? Like, what's your experience been with the groups that you work with? Yeah.
Absolutely. So leadership takes a lot of different forms. And I believe that for students, I think there's an opportunity here to be able to climb the ladder. If you are able to be, first of all, our organizations have student governance, and I think that's a great place to start. Our committees also have opportunities for students to join our committees. I ask people to join a committee, and then someday you're going to chair a committee, and then somebody's going to say, maybe you should run for this particular thing. Just as she said on the state level, on the national level that I've been on with the American Academy of Physician Associates, it works like that as far as how do these committees work? How do you get accomplished? What is the governance of the story? I think that's a very important story to understand. So really, I think it's a little different than people think of like group work in the student space in terms of this has a very specific charter. You have staff supporting these goals and have a very specific outcome and checkpoints along the way. So I think it's on the national level at APA, it's very well supported, and all of our commissions and committees do a great job.
All right. Jennifer, any thoughts on that?
Yeah, I really think it's important to embed this philosophy of being part of the healthcare community at whatever level you're on, whether it be with, again, right where you work, and doing your everyday job, that your job is to participate in the healthcare system as well. So whether it's joining MAPPA and being on one of their committees, joining APA, being on one of their committees, kind of getting your feet wet, doing that. And then when the call comes out to say we need PAs at the state level to join those healthcare committees, we're already kind of moving forward through that process, and you got that experience and understand how these work, and pretty much being on a committee, whether it's at the national level with APA or at the state level, there is a lot of collaboration and teamwork that's involved. You pretty much never get exactly what you want, but you come out with a product that should be good for the greater good.
All right. So on the subject of getting what you want, say sort of at the national and at the state levels, what's kind of one thing that we should be focused on in the next couple of years from your perspective? Is there a specific issue? David, I know you and I have talked a lot about just scope of practice in general, but are there specific things kind of that we should be thinking about as a profession and for particularly the students who are coming into the profession now?
Yeah, there's one thing that is at the top of my list, and every state is in different places, and some states have achieved this, that I believe that, and while I really applaud Maryland's step from the supervision to this collaborative practice, it still does represent an official administrative connection to a physician. And at the national level, we really believe that that gets in the way administratively, not clinically. Clinically, the answer is the healthcare teams are working together all the time. The argument about independent practice is a red herring. If somebody's bringing up independent practice, the answer is they're trying to start a fight. What I believe is that we should not have a connection as a professional who has gone through your professional school, who's licensed through your state, who has oversight on many different levels. You shouldn't have to tie a physician's name to your license and to your practice. I think that limits how PAs can be deployed. I think it administratively limits the care we can provide. So if I had one wish, I would take that away because I think that helps access on many levels.
All right.
I would really like to reiterate that. It does create significant administrative barriers for all levels. And one of the ones that I'm most concerned about, and I've been, working with Robin to see how we advocate that, is on the insurance company level. I think a lot of people don't recognize that although we have lobbied successfully to get direct billing for PAs at the national level through CMS, that here in Maryland, we don't have the ability with certain insurers to be able to bill for ourselves directly, and that the physician's name has to be on all of the things that we do, regardless of the way the state law says that we're in a collaborative practice, regardless of the way we've removed agency from our state law, that these are larger practices and policies through larger corporations that we really need to directly affect through advocacy. And even if it's not an insurance company, it could be a large corporation, whether it be, and I hate to mention names, but CVS or Walmart already has policies in place where PAs are still struggling to be able to write their own prescriptions without pushback from these large corporations that have their policies. So that is where I really see our next level and next step is to be able to move forward with our practice and seamlessly be able to provide care, regardless of having these other administrative barriers in our way.
Just lifting up what Jen just said, I think there are several key legislative goals that we have in Maryland, and then I know nationally, and then in our states around the country. What I would like to lift up is the importance of implementation. So often you do this big push, it's intense, you get the bill signed, it's really fun, you get to go to Annapolis, you get to meet the governor, and you get to celebrate. And that's extremely, extremely important. Implementation is sometimes harder. So the example of the insurance barrier that Jen just mentioned, there are laws on the books which should already eliminate this barrier that PAs are facing in getting on provider panels for insurance or getting on provider panels with minimal amount of hassle. Getting that fixed with insurance companies is not easy, especially when those insurance companies are not located in Maryland. So implementation is a huge part of building into any advocacy campaign and recognizing that it takes some time and it takes some trial and error about what works. And so just wanted to lift up the importance of that. And it's actually why all of you are important, because if you're working mostly in Annapolis, you're on a ledge committee, you're focused on that legislation, what's really important is hearing what's actually happening in reality and what those barriers are. If I can just tell you once in a while, I get an example of a barrier, it's golden. It completely violates the law. And I have to tell you, I get so excited. Not that the law is being violated, but that I'm like, oh, this is perfect. Then I can call the legislator in your district or the legislator I know who will be equally irritated by this violation, and we can take steps to get it fixed. But we don't know about those things unless we are all part of the same group and kind of communicating. So thank you for those of you who bought those examples already. Mm-hmm. And thank you to all of those who will bring them in the future. So
that's great. Yeah, it's always lovely to be able to point out something and say, this is really dumb. Like, why are we doing it this way? Because then everybody sort of can see that and say, oh yeah, this is really dumb. We do need to fix that. I mean, not that this ever happens in education. So, but I want to actually switch a little bit and talk about education, because obviously we are particularly as a university, very invested in the future of the profession and what it means for all the students who are coming up now, the students who are coming in the next generations. So from your perspective on the advocacy stage, what do you see as things we need to be working on about the education of PAs? What are some critical issues around that in terms of our curriculum, in terms of the way programs are structured? Thoughts on that?
I could absolutely write a book on it, but let me
Take the short version.
let me discipline myself on this point. I think we are innovators in the PA world and in health professions education around competency that we serve, and we are aimed at providing competent providers for the not too distant future. We are connected to the patient aspect of it more than some other professions as well. So I think being tied to those communities, I think something that we are struggling with in the PA world, and I do believe is with every health profession, is transition to practice. We do an amazing job with PA education. People come a long way very quickly. Then we get out into the world where there was an old model for PA transition to practice that doesn't exist anymore. And that old model was you worked for a practice and a physician had a return on investment of working with you because it brought them more money or more time in their life. Those employment models for physicians are all but gone. That they are employees, they are union members, and they're saying, what's in it for me? So I really think that the education needs to, because I think it's the handoff between education and practice, is how are we transitioning? How are we taking responsibility as a profession for these new PAs to make them excellent? Because there are fewer and fewer people standing up to say, I'll do it. We're seeing it on the clinical education side, and the pain is real on the new provider side.
That was very, very well said, and I absolutely agree with you. But included in that transition to practice, I think really needs to be embedded the philosophy that we are part of a healthcare system and a healthcare community. And again, I said this earlier, our nursing colleagues have this down. They know how to to teach their nurses and their nurse practitioners and all APRNs how to be embedded and be part of the healthcare system. We need to learn from them, and we need to know how to do that ourselves so that we also are those leaders that are at the table, that are on those committees, that are embedded into these processes. And we do an amazing job about turning out great clinicians, right? Like I would be treated by a PA any day, and I would trust any of these of the programs in Maryland to treat me or my family member because I know the people that are teaching everyone and I trust them implicitly. Where I think we fall short and where I think we really need to improve is not just having a class on leadership or how do we, teach you how to transition to practice, which is absolutely important. How do we teach you how to integrate into the healthcare system as leaders? We are leading healthcare teams. We are the ones on the floor. We're leading the nurses, and we need to be able to impart that and embed that into our curriculum. That's where I think we need to, and I don't think that it's going to be a huge lift. I think it just needs to be part of our communication and our mantra every time that we teach a class, every time that we're doing it, is understanding that PAs are the leaders on the healthcare teams.
So I've never been to PA school and don't know what it's like to transition to practice. So I just want to sort of lift up something that I think is becoming of great interest in Annapolis among legislators, state officials, that I think affects every healthcare profession. And that is, how do we support students who want to go to school, come to school, and don't have the full resources to do that, beyond scholarships and financial aid. And thinking about how do we support students with families who are maybe struggling with other sort of work life, family balances, who are struggling with housing insecurity, food insecurity. So these are very difficult issues, not easy to solve, but there's a lot of interest in addressing that. And I think it's in recognition that if we want a vibrant, diverse, and committed healthcare professionals, whether any of those professions, that we need to make sure that everyone can access education. It's not just financial, it's also sort of those life circumstances. So there's not a lot of money right now to do a lot of work in this, but I think what we'll see in Annapolis and what we've already started to see is really kind of laying out some of those programmatic aspects that could help with that. I'd say we don't have a lot of money right now, but what we can do is plan and think about how maybe we deploy some of the resources we already have in slightly different ways.
All right. You had a quick comment?
I'd really like to tag on to that because I think that we saw an example of many of the different levels of education. And I think what Robin brings up is perfect to be able to have a dean here because this is really talking about bringing the resources that universities have to bear to support our learners. And that's what deans and provosts and presidents were created because what we're seeing is that we are doing our very best to be able to bring in learners from communities that we serve. And all of these learners are humans who have the problems that all of us other humans have. In this concept that during this crucible of PA education and many other health professions, that some of those things come to the fore and to be able to provide university resources to say, we can get you counseling. How is your housing? Here's the food bank, which honestly, I didn't have a sense of the degree of food insecurity until I got into academia of day-to-day students. So I think that what she's speaking is something that universities and university systems were born to provide.
All right. Well, thank you all. I know that from the timer we are out of time, but I could go on for quite some time. Thank you for being here and for providing your contributions. All right. All right. I want to move to the next thing, and that is to introduce our student speaker, who is Laura Hassan. Laura? Laura is a second-year PA student at University of Maryland Eastern Shore, right? All right. Master's of Science in Education, president-elect of the Student Academy Board of the AAPA. So take notice, getting involved. And also class president, because who doesn't want to be class president? Nice to have you with us.
Thank you so much.
Thank you. You want to?
Thank you guys so much. Thank you, Paula, MDAPA, Dr. King. Thank you guys for inviting me here. I appreciate it. It's an honor and a privilege to really be able to speak in front of you all. So I'm just going to speak a little bit about my journey to PA school and my journey into advocacy. So when I think about what becoming a PA means to me, I don't really think about one single moment. I think of a lot of small moments. And I think about drawing charts and stick figures on the board for my classmates at 12 a.m. I think about explaining physiology, like I used to explain science to teenagers, and turning confusion into, oh, that really makes sense now. And that's who I've always been, a teacher. And I didn't realize those times, all those nights staying up, breaking down concepts, were quietly preparing me for being the kind of PA that just doesn't treat patients, but also teaches patients. In a national survey, patients said what they value most about PAs is the time that we take to explain things, to make medicine understandable, and to make them feel seen, heard, and understood. And that's it. That's really the soul of what I'm going to do. And I've seen that firsthand in rotations, sitting beside preceptors, watching patients finally exhale when someone explains what's happening to them in plain language. And I can't help but think this is what all drawing those charts was for at midnight, just so I can be able to do this in front of a patient. And I also want to talk a little bit about advocacy too, because that's why we're here. Because for me, becoming a PA has never been separate from speaking up. A few weeks ago, I was standing in the halls of Congress at the Leadership and Advocacy Summit at DC, and I was talking to Maryland representatives about what it's like to being a PA student today, the barriers, the passion, the work we're ready to do. And like one of the speakers earlier was talking about, but when you speak to Congress people about being a student, you can really feel the energy shift in the room. They really listen when students show up because it tells them that the fight isn't over. We are the next generation of advocates. We are the catalyst, and our presence really says we're not just coming, we're staying. So here's the thing about advocacy. It's not just about going to Capitol Hill. It's about the next person you bring with you. It's about handing the mic to someone that's coming behind you and saying, now it's your turn. That's the most important thing you can do after being inspired, is to share your message with a mentee. Let them put their own spin on it and carry it forward and make it better. That's how movements last, not through titles or reputations, but through torch passing. And from the start of PA school at UMES, my goal was to contribute to the growth of the program and the people within it. And not because anything was wrong, because I wanted to add something good to what was already here. In fact, Professor Rutan and Dr. Thompson and all our faculty just put in long hours to clinch our 10-year accreditation because congrats to that. Impact is really the only legacy worth leaving. And now I look around and see how far we've become. UMES is now, it now has one of the strongest student involvements in terms of PA school on the national level at AAPA. Yep. We've strengthened our outreach on the Eastern Shore. We've shown that a small HBCU program on the Eastern Shore can have a national voice in the profession. And my dream goes beyond recognition. I want to see PA students travel abroad on medical missions, serve in rural communities, and make the lower 3 counties of Maryland, which is a healthcare desert really, but make it really healthier by just showing up. And I want our Eastern Shore to be proud of the PA program that exists here because it means life and access for people that call this place home. That our presence as PAs are not just in clinics, but also the heartbeat of that community. And before I ever came to Capitol Hill as a PA student, I went as a teacher for the Society of Science and the Public. And back then I spoke about my robotics students, trying to get them into national science competitions. But now I speak on behalf of PAs, reminding the administration that we belong in all healthcare situations too, all of those conversations. We are going to continue fighting for modernized laws, for equitable healthcare access, and for recognition that our voice matters in shaping policy. And I've come to realize that advocacy, education, and patient care are all the same act. They are all love in motion. We advocate because we care. We teach because we believe people deserve to understand their health. And we serve because we know that we're all capable of changing something, even if it's just one person's day. That's what becoming a PA has meant to me. It's taken everything I used to do, teach, mentor, speak up, and given it a purpose inside of medicine. So to every student, faculty member, and clinician here, keep teaching, keep speaking, and keep showing up. Because when we do that, when we each leave things a little bit better than when we found them, that's when we truly embody what it means becoming a physician associate. The fight isn't over, we're just getting started. Thank you so much.
Yeah, I think I saw some tears in the audience, Laura. That was beautiful. Thank you. So So we are actually going to move into a break. And it is, let's see the time here. We'll be back here in the next 7 minutes. So everyone, please take a moment to refresh, and we'll see you here shortly. Thank you. All right. If everyone doesn't mind taking their seats, we're going to get started again here. Excellent. I just again want to express so much gratitude for these incredible speakers we've had today thus far, doing great work. And the panelists will all stay after a few minutes. If anyone has any specific questions for them, they're welcome to come to the front. But now, without further ado, I'd love to introduce our lovely Laura Rose Dunn O'Farrell, who is the current MAPPA president, to come and say a few words.
Good afternoon, everyone. Well, I got a little response there. Good afternoon, everyone. All right, there we go. Happy Friday. So, on behalf of the Maryland Academy of Physician Assistants, I really want to thank each and every one of you for coming out to support this event, but also to show up for the profession, you know, and what we stand for and what we're working so hard to accomplish together. You know, being in the presence of colleagues, students, friends we haven't met yet, really is meaningful and really powerful. Thank you to PALLA also for hosting and UMB. So as has been mentioned by our panelists, we are at a pivotal juncture right now in the state of Maryland, but then also nationally. So in 2024, nearly 80% of Maryland's jurisdictions, were considered federal shortage areas for primary care and oral health. 92% were shortage areas for mental health. Some of the Maryland community surveys show that 92% of our Marylanders are either very or somewhat concerned about the access disparities that continue to face the profession and our patients. And 90% express similar concerns about their children and their behavioral health needs. Nationally, in 2023, about 1/4 of adults reported delaying or not receiving any health care because of the cost. 37 million Americans were uninsured back in 2021, and 41 million have had inadequate health care access even since. Uninsured minors have a propensity to become the uninsured adults, right, that most of us come to treat. Some of us do help or serve pediatrics, but a lot of the training really surrounds kind of that adult population. But there's an indication to kind of go back, right? Go back into the childhood. What are we really ingraining? Whereas Dr. Beauchamp said, what are we embedding even early on? What we're able to prevent even at that early time in life, that is really a huge determining factor for where we are going to go with chronic health and the chronic health conditions that are burdening the healthcare systems and our costs today. So while these healthcare needs of our communities have gone unmet, I dare say that our voices have grown stronger and grown louder in our communities. We now have about 5,000 licensed PAs in our state of Maryland, with around 14% of them as current MAPPA members. According to NCCPA data reports from the period of 2019 to 2023, PAs in Maryland increased by 17.5%. And as of 2025, Maryland has 100% student membership from our educational systems. And that's totaling over 300 students. So that is not even including with the Mount St. Mary's starting with their first cohort in January. This represents 6% addition and bump in that advocacy power in this next year to come. A lot of work has been done by Elizabeth Donovan and the MAPPA team for even the pre-PA pipeline, right? Because it's not just by the time you get into education to make the difference. It's even earlier than that to really change the trajectory. And so the pre-PA students, the PA students are really that pipeline into the future. And so I think it's important that while there's so much talk about innovating our systems and, in part to help bridge these healthcare gaps, it's also really about strategically, thoughtfully, judiciously developing efforts to maintain systems towards sustainability. We all have great ideas. We all want to, do the exciting things, but there's so much important we are building as we are building it and as we are planning to build it. Innovation without maintenance, it's not resource stewardship. It's time and effort lost. So with the focus around advocacy, I myself love etymology, and the study of language. And as that has also been a theme, how we use words matter, verbally, non-verbally, written form, what we choose to say, what we do, and what we choose not to say and not do. All of that is action, and even inaction is action. But so the term advocacy from the Latin roots, advocare meaning to call to one's aid or to summon for support. So in combination of the prefix ad to and vocare to call, in and of itself, vocare is the voice. We have been growing our voice, and as has been mentioned by all of the other speakers, anything you do, it can be advocacy. It's taking it an extra step in the conversation. It's saying, hey, tell me more about your background. What do you do even outside of being a PA or a student? It's developing the connections that matter. It's the way that we choose to be rooted with one another, in this ecosystem. I will say too, advocacy means challenging misconceptions. Just recently, I was at an event for the Frostburg program, and I came across a community pharmacist who's, I think, well known there. And we were talking at the event, and she says, "Don't we have enough PAs?" And I was like, "Oh, well, there's actually a healthcare shortage," and kind of given some of the spiel, and she goes, "There is," as though one, I don't know what information is available for what she's encountered, but what struck me most was that this was actually not a reflection of what she was saying, but the underlying message of what was being conveyed. And what I took from that was there must have been maybe some other experiences that kind of led to this kind of questioning. That was the impression, is there's a perception in these further reaches that I think we can do a better job with amplifying our voice, in combating with some of the implementation for modernization, but really the antiquated systems of what has existed. Now we know that that area is a shortage area, right? And needless to say, after we talked for a couple minutes, she goes, "I like her." And then it was a completely different story. But being willing to engage the conversation with respect and professionalism is part of what changes the narrative. It changes the opportunity for misconception in whatever's been communicated in the past, or perhaps even some of the negative experiences that could have been mitigated. So even when it's uncomfortable, use that space to make the connection, to be the bridge, and to advocate. But anyways, that kind of permeated my soul, and I was like, oh, I'm dedicated to advocating here. That's meaningful. And so while this event is really to, kind of a celebration of all of us together and what we're moving toward, it's also really a call to action. The timing is important. Everything we do and don't do matters. We have a shifting system filled with leaders, educators, future healthcare providers, community stakeholders. PALLA and MAPPA kind of serve as that scaffolded bridge, so to speak, right, to unite some of our efforts across the state, but then even nationally. So what we are modeling is that we can be the connection together. We can cross that divide. We can funnel leadership, talent, and resilience, because it just gets sweeter the more concentrated we are together as the solution. I know, nerd. One fun thing that you'll, for anyone who hasn't worked in rural healthcare or just in that area, everybody knows everything about everyone else. You can be 30 miles out, not a soul around, but they know things before you can ever know it. So there's connection in that community. And it's not about just the physical proximity. The connection's much deeper than that. And so you're here today because you care. You were voluntold maybe, but nonetheless, you're an advocate, even if that's not a part of your self-narrative or a part of your identity as it was when you formed it. But we're all evolving. We're all becoming our better selves, and that identity evolves over time. So I think that's important that terminology becomes a part of our everyday culture, because that is also how we build that in or embed that into the community. So in closing, and before we transition to our next activity, kind of highlighting that at the federal level in 2024, there were groups of individuals that got together and over 190,000 letters got sent to Congress asking for strengthened 24/7 access to care and protection of essential healthcare funding. In Maryland, as was mentioned, we had so many advocates show up for the advocacy days, and what a difference it made having you all there, having that presence, having the stories, having the real life experiences that transcend all the words on paper. It makes it real. It helps legislators connect and realize, why am I spending late nights working on this 100-page document? That's why. It brings it to life and it makes it meaningful. So I encourage everyone leaving here today to help our professions, educational programs, and community organizations really put our economic impact where our mouths are, address the burden of disease through health prevention and promotion, and mobilize our words by putting advocacy into action. Thank you.
Thank you, Laura Rose. So now we are about to begin our advocacy and action section. So this is where you all get to get your hands dirty in the legislative efforts here with MAPPA, if you so like. We have 3 different letters that were written by the legislative director, Dr. Beauchamp. One is for community members, one is for PA students, and one is for PA professionals. So if you would like to participate in this to support PA parity, we have paper copies of the letters today. You're able to sign those. We will have people walking around the room. Raise your hand if you're a community member and you'd like to participate. Raise your hand if you are a PA. Raise your hand if you're a student. And these letters will be collected by our legislative director or sent on to her, and she will use them at their next legislative agenda to support passing PA parity through. No obligation to participate, of course. For those of you who are virtual, we will be dropping those letters into the chat. You can print them and sign them and mail them into the address that I will here display. Or you can sign an email. Sorry, our mouse disappeared. Yes, so if you want to distribute some of the letters, and then Dr. Beauchamp will come up and talk a little bit more about what PA parity actually means, so you know a little bit about what you would be supporting.
Right. Thank you very much, Dr. King. So, Robin Elliott talked about PA parity a little earlier. Really, it's about, it wasn't that difficult. We actually went through the legislative law and did a find where there were APRNs and where there are physicians, and we want to have parity with those practices doing the same jobs. So, there's separate legislation outside of the PA modernization law that dictates how we practice. And so this is to create parity along those other health laws where we can then practice to the full extent of our license. So we don't have bill numbers just yet. So these are basically letters supporting PAs practicing in parity with other professions that are doing the same job. Okay. I just also want to say thank you for everyone who is participating. I want to say how important it is, and again, like Robin alluded to it, the personalization of this, I think, is really important, which is why we decided to have letters and have actual signatures. There's lots of email communications that go out that are blanket, that fill the legislators' email boxes, but actually having letters with real signatures, I think, is a thing of the past and really makes a statement. So someone can actually hold it in their hand, and everyone is taking the time to actually sign a piece of paper that we can then take to the legislators in Maryland is really important. So again, thank you so much for your support in doing this.
Jamie, we don't need the mics.
Oh, are we on? Oh, are we live? Yeah, you can hear me. Okay, just making sure. Testing. Yes, thank you. All right. So thank you all for those who participated. And if you're interested in learning more, you certainly can email the legislative director at mappa.org. And again, there is the address that I had mentioned for MAPPA to mail in some signed copies of the letters if you choose for those who are virtually participating. And now we're going to jump right into the MAPPA Awards 2025. It is it is my pleasure to introduce a couple of our brilliant MAPPA leaders. We have Dr. Wynn Park, who is the awards committee chair. And as you have all met, Ms. Laura Rose Dunell Farrell, the MAPPA president, who will be handing out awards this year.
Hello, everyone. The moment you've all been waiting for. Are you advancing slides? Perfect. Okay. So first thing, we didn't introduce Kathy Burrows, who is part of my amazing awards committee. We also have Deanna, Ellie Walker, Elizabeth Donovan, who unfortunately could not be here today, but we all have, I always say being a PA is the best job in the world after being a mom. Being on the awards committee, also super fun, one of the best committees. So, if you're thinking about a committee to join, I would highly recommend this one. Special thanks, of course, to Jamie. Where are you? There you go. For all of the work, putting all of this together. Okay, so let's get started. The Evie Woolman Scholarship. Now, I want to make sure that I get all the details right. Evie Woolman was one of the first PAs in the state of Maryland. She was a pioneer with a positive attitude and great work ethic. Unfortunately, she lost her battle with cancer at a young age, so a scholarship was funded in her honor because of her passion for PA education and the PA profession. The MAPPA Board of Directors and General Membership continue to fund the scholarship to memorialize Evie and keep her spirit alive in the PA community. So our award winner, unfortunately, is not able to be here, but I did want to speak about her. Her application stood out as representing the values of our profession and more than satisfied the criteria for our scholarship. One statement from her essay that stood out and captured our attention with the awards committee, and it truly seemed to capture the kind of student most deserving of the scholarship. She wrote, "Modern medicine must combine advancement with compassion and accessibility." I know that was just gorgeous. So she does a lot of volunteer work with the Haitian community in which she assists in outreach programs and health fairs, distributing food to people in need, conducting vital screening, bridging language gaps to explain diabetes risk and medication adherence. This truly exemplified Evie Woolman's spirit. In addition to this volunteer work and other outreach efforts, Laura is also a dedicated Maryland AHEC scholar, a selective longitudinal program that focuses on preparing healthcare professionals to work in underserved and rural areas. In her letter of recommendation, Dr. Alziadi stated that Laura has consistently demonstrated not only exceptional academic ability, but also an unwavering commitment to the PA profession through advocacy, community engagement, and health equity. So, unfortunately, our student Laura Nelson is standing up in her best friend's wedding out of the country and is unable to be here to accept the award. However, we will share this at a later date.
We have
Yes, we have her online. That's so exciting. Okay. So, Laura, wherever you are, if you're able to, I don't know, is she able to speak or no? Okay. Oh, darn. Okay. Well, we miss you and we wish you were here. And we'll make sure to get the check and the certificate to you. Don't worry. All right. Next person. The Rising Star Award. So this was an award that the awards committee came up with several years back where we thought there's not a great category for someone who's kind of new and up and coming. We really want to celebrate a person who, a PA, who has proven themselves exemplary in the first 1 to 3 years of their practicing PA career. This can be through any combination of the following. It could be excellence providing healthcare to communities in the local, national, or international level. Leadership, which encourages involvement in PA organizations and professional development of others. Actions which reflect and promote the role of PAs as pivotal members of the healthcare team. Or volunteerism, especially in underserved communities. So this year's winner began her career in emergency medicine at Johns Hopkins Bayview Medical Center, where she quickly distinguished herself through her rapid acquisition of clinical knowledge and technical proficiency. She was credentialed to work independently in all areas of their ED, including trauma and high acuity care, faster than any new graduate in recent memory. They described her ability to perform complex procedures and manage critically ill patients with confidence and skill as remarkable for someone so early in their career. Beyond her clinical experience and excellence, this rising star exemplifies the role of the PA as a pivotal member of the healthcare team. She's consistently recognized by colleagues across all disciplines, technicians, nurses, and physicians for her professionalism, communication, and collaborative spirit. This also earned her the department's inaugural Silver Star Award for outstanding care of geriatric patients, a testament to her compassionate and patient-centered approach. The awardee's leadership extends beyond the hospital walls. As a practicing paramedic, she serves as an informal but essential bridge between the pre-hospital and emergency department communities. Her dual role enhances continuity of care and fosters stronger collaboration between EMS and hospital staff. Notably, she was invited to present at the Johns Hopkins Bayview Spring, meeting, which is also very notable for someone who was so new in their career. It's a rare honor. She brings a strong academic foundation, having earned multiple degrees with honors and contributing to EMS research. She's giving back to the community by precepting PA students and early career PAs. She was recently nominated to serve on Bayview's APP Advisory Council due to her maturity, clinical poise, and leadership potential, but was ineligible because she had not yet been there for 2 years. So those who recommended this year's Rising Star commented that in her first 2 years of practice, she has already demonstrated the excellence, leadership, and service that this award seeks to recognize. So please join me in congratulating PA Heather Winger.
You're responsible for the picture.
Come on in.
You.
You don't have to say anything if you don't want to.
Thank you. This is such an incredible honor. So thank you so much.
I'm telling you, best job ever. It's so fun. And I comment on how fun it is, but in reality, this is a form of advocacy, right? We uplift one another when we see what PAs can do. And I mean, she's only not even 2 years out. I can't wait to see what else she does. All right. So our next award is for the PA Educator of the Year. Thank you. So the Educator of the Year recognizes a PA who has demonstrated praiseworthy behavior in her role or his, as a PA educator. The PA selected for this award exhibits behavior and traits which reflect favorably on him or herself and on the PA profession. Through designation of the title MAPPA PA Educator of the Year, the Academy seeks not only to honor the individual PA, but also to provide an example to the public and healthcare community of a PA who promotes and excels in the education of PAs. This year's award winner decided to become a PA educator after nearly a decade of practice as a hospitalist and emergency medicine PA. While she loved clinical care, she felt called to shape the next generation of PAs and address the lack of diversity in the profession. Only 3.3% of PAs were African American when she began teaching, and she wanted to ensure that Black, Indigenous, and people of color not only had the opportunity to matriculate into a PA program, but also to succeed. One of the comments in a letter of support for her stated, her mission is to position her PA program as a magnet and a crucible for the success of underrepresented PA students. I just want to let that sit with you for a second. Not only does she want to educate the next generation, but she actually wants to make sure it's a place where BIPOC people are welcomed and can succeed. Since joining the University of Maryland Eastern Shore PA program in 2022, she has dedicated herself to advancing excellence in PA education. She currently serves as program director and department chair, where she led the program to a historic achievement of full 10-year accreditation with 0 citations. Let me tell you, that is not easy. Under her leadership, summer 2025 marked her program's strongest semester. All students earned above a 3.0 average, without any on academic probation and 0 attrition rate. PACRAT 2 scores exceeded the national average, and faculty retention reached 100%. That's huge. In this day where it's very, very hard to recruit PA educators. Outside the classroom, she promotes interprofessional activities within the School of Pharmacy and Health Professions and leads initiatives with students. She also testified alongside Senator Carrozza and other PA leaders in support of the Maryland PA Modernization Act, which passed in May 2024. She has also accompanied students to Capitol Hill to advocate for multiple health education bills. She has mentored dozens of PA students who have gone on to become clinical leaders in various parts of Maryland and beyond. While performing all of this hard work, she has produced several research and scholarly products in peer-reviewed journals. One of her nominators stated, as an educator, her commitment to student success is outstanding. Her advice to those considering PA education is to embrace it wholeheartedly. It is challenging yet deeply fulfilling. Please join me in congratulating PA Nicole Wooten as MAPPA's Educator of the Year.
Okay.
You don't have to.
Okay, I just want to say thank you. I'm definitely honored, and this means a lot. It's definitely been challenging, but we have all worked together to be able to make this happen. And I did speak with Laura, who's also our student, and she said thank you, and she's honored as well. So thanks.
So our next award is for the MAPPA PA of the Year. The MAPPA PA of the Year award is presented to a PA who has gone above and beyond the call of duty in their service to their patients, community, and the profession. The winner of this award was also nominated for numerous other awards this year, evidence of the fantastic work she has been doing for our profession. As the director of the Emergency Medicine PA Residency Program, a program she helped design and launch, she has guided almost 2 decades of graduates through one of the most rigorous clinical emergency medicine postgraduate PA training programs nationwide. She's someone who has devoted her personal and professional life to the advancement of PAs and improving patient care. She understands that the success of our profession is tied to and is equally important to as the success of the healthcare systems in which we work and the patients we care for. Her work as the assistant APP manager and work on the APP Advisory Council, EPIC Task Force, Office of Graduate Clinical Education has been impressive, persistent, and admirable. She wears so many hats. And as one of her nominator said, she is still so responsive. I truly don't know how she does it. She's compassionate but pragmatic, compassionate but stern. She was instrumental during the COVID crisis in guiding our department through wildly unpredictable times. She knows when to take charge of a situation and does so well without shying away from responsibility in times of crisis. She's also very collaborative, always looking to develop new leaders. Over the past 25 years, she's had the privilege of shaping the next generation of ERPAs, combining clinical excellence, leadership, and mentorship to help advance our profession. Her career has been grounded in a passion for both patient care and education. She stated that her greatest professional joy has come from helping to develop PAs into confident, capable, and compassionate providers. Please join me in congratulating PA Mary Masterson as our PA of the Year.
Thank you very much. Thank you, everyone.
The next award is the PA Physician Team Award. This award honors a PA physician team that exemplifies the unique relationship of trust and mutual respect that is essential to the team-based approach to healthcare. This collaboration allows both the PA and the physician to provide greater care than either one would be able to do alone. Further, the physician must demonstrate a commitment to the PA profession via actions that advocate for and empower PAs to work to the fullest scope of practice. So our PA physician team member first met their MD in 2011 when they were searching for a primary care physician after PA school. He was drawn to the MD's compassionate and holistic style of practice. When a PA position opened, the following year, they joined Crossroads Medical Associates in February of 2012. From the very first day, the physician set the tone for what has become more than a decade of collaboration, mentorship, and mutual respect, what he has always envisioned as an optimal PA physician team. This physician helped not only to foster the PA's professional growth, not only providing guidance on complex medical cases, but also encouraging independence when appropriate. His style of collaboration helped instill confidence in clinical decision-making and helped to build a culture of continuous learning. Over time, this partnership evolved from a mentor-mentee relationship into a true clinical collaboration. In 2017, the PA gained even more autonomy when the physician encouraged him to start a medical clinic at Lutheran Village at Miller's Grant, a local assisted living facility. Equally important, the physician has been an outspoken advocate for the PA profession. He has consistently supported legislative efforts to expand PA practice in Maryland. Their PA group and this physician collectively contributed $5,000 to MAPPA's 2023 legislative fund to help advance PA scope and representation, he encourages the team to practice at the top of their licensure, pursue leadership roles within the practice, and develop specialized skills that elevate the quality of the clinic. Under their leadership, they've expanded their services to include acupuncture, the Crossroads Apothecary, nutritional consults, a Crossroads Teaching Kitchen where they teach patients how to prepare healthier food options, a bone health program, brain health program, a longevity program, and ultrasound guided procedures. And their team also values mentorship. When this PA first started there was someone working in the apothecary who had no idea what a PA was until they met our PA. They also subsequently went on to PA school and became a PA themselves and then joined the practice. And then right, that's the way to do it. That's how we do it. So they welcome another PA into the practice, and that has helped to strengthen their multidisciplinary care. So each addition reflects the belief that empowered PAs elevate not only patient care, but the profession as a whole. I thought the really cool thing is that they also both share a love of music, and they both love to play guitar. So I did not ask him to bring his guitar, unfortunately, but that would have been nice. The advice I have for fellow PA physician teams: find the balance between autonomy and collaboration. They have created an effective partnership because we recognize and celebrate what the other brings to the table. In our case, mentorship evolved into mutual respect and true collaborative practice. After more than 13 years together, their partnership continues to embody the best of team-based care, anchored in trust, advocacy, and a shared mission to serve the patients in our community and advance the PA profession in Maryland. So please join me in congratulating PA Joshua Anderson and his physician team member, Dr. Ross. Who could not be.
Thank you so much.
Come on up.
I don't know, we get a picture or not. Thank you all so much. Dr. Ross wishes he could be here, but he is out of state right now. So I appreciate this so much.
Earlier when I stood next to him, I said, "You don't have to stand up." Okay. So last but not least is our Lifetime Achievement Award. I really want people to understand the gravity of the different awards that we give. And that's why I'm reading to you the descriptions of what the awards, what goes into the criteria and how we selected them. So this award recognizes a PA who has exhibited the highest professional qualities, both as a PA in general and through involvement with MAPPA or other state organizations during their lifetime. The candidate has to have demonstrated consistent adherence to the highest principles of PA practice over a significant amount of their professional lifetime. We look at letters of recommendation, testimonials, evidence of achievements and awards for professional activities, evidence of voluntary work which is directly related to healthcare or which brings positive recognition to the candidate as a PA. The candidate has to have shown significant involvement with MAPPA or other state organizations over a lengthy amount of time. They have to have shown involvement in professional development as a PA in areas other than state organization involvement. And they have to have shown intellectual or educational achievement as a PA. So our award winner has demonstrated all of these things. She has been a PA for 51 years. She is a founding member of MAPPA since 1977 with continual membership. She gets free membership from now on, but I think she's more than paid for it. She is a well-respected and experienced and certified pioneer PA with experience in adult pediatric dermatology and dermatologic surgery. She has extensive clinical practice experience, leadership, and contributions to numerous professional organizations and education. She attended Johns Hopkins School of Health Services, another shout out to Johns Hopkins, Essex Community College in 1974. She got her Associate of Science in Physician Assistant Studies in 1974. She has had an NCCPA certification since 1975, Maryland Board of Physician since 1975. She's continuing to practice, and she'll tell you a little bit more about what she's going to be up to afterwards. She served as a preceptor for undergraduate PA students, certified PAs, held presidencies in numerous professional PA organizations, and engaged in legislative advocacy for PAs. She's a community educator and guest speaker numerous times. It all doesn't fit in one page. Hold on. She's won numerous awards, including the Joe Monroe Lifetime Achievement Award with the Society of Dermatology PAs. She was presented with the Top Doc PA Award in Maryland. She was recognized by the by NCCPA as one of 223 PAs, nationally consistently certified for 40 plus years. She was our PA of the Year in 2013. Again, more than one page. Hold on one second. She received an award from the American Academy of PAs as first place award for outstanding achievement in public education given at the AAPA 22nd annual conference. She received an outstanding service award. She has an award also here from the Young Leadership Council and Advanced Leadership Development Council. And she has a super long list of publications that I'm not going to read to you. So to tie it all up, we have with us a highly esteemed, wonderful example, a paragon of our profession. And please welcome me in congratulating PA Esther Cohen for the Lifetime Achievement Award. You may.
Yeah, okay. Thank you very much. I can't believe you're speaking about me. I was just living life and having fun. It is a profound honor to accept the Maryland Academy of Physician Assistants Lifetime Achievement Award for 2025. To be recognized by one's peers for lifetime of service to patients, to our profession, and to our state is both humbling and deeply meaningful to me. When I began my career more than 50 years ago, the PA profession was still in its infancy, new, often misunderstood, and uncertain of its role in healthcare. In 1972, at the young age of 22, which was very young at that time to go into the profession, because all of my classmates were at least a decade older than me. Most of them were corpsmen. I attended the Essex Community College, Franklin Square Hospital, in partnership with Johns Hopkins Hospital. It was the first PA program in the state. That class of 1974, upon graduating, stood at the forefront of a transformative era in medicine. I remain indebted to my mentor, Dr. Archie Golden, a visionary whose guidance shaped both my career and PA education in general. I also wish to honor two founding members and past presidents of the Academy. Robert Elwell, our first president and a Vietnam veteran, led our organization in its early years and passed away in 2011 at the age of 63. Dixie Kaminsky, our second president, dedicated her career to advancing licensure and education for Maryland PAs and passed away in 2018. Their contributions remain fundamental to the Academy's success and the PA profession today. Their legacy continues to light our path. In 1980, I became the first PA in the United States to specialize in dermatology. At that time, there was no precedence, no established model, and at times even no acceptance. The challenges were many, including opposition from a licensing board for performing procedures as simple and basic as cryotherapy. My livelihood was on the line, as well as the PA profession. Yet, I stood my ground, and with the steadfast support of MAPA, we stood firm. Together, we established the groundwork for the professional autonomy our colleagues enjoy today. Yes, there are now 125 dermatology PAs in the state of Maryland and over 4,500 nationally. We've come a long way, baby. In a reflection already stated, There are more than 5,000 certified PAs in Maryland and nearly 200,000 PAs in the United States. This growth reflects a simple truth: the trust patients and physicians place in our skill, knowledge, compassion, and our professionalism. But progress carries a responsibility. All PAs and students must understand that what they take for granted today was not given freely. Every prescriptive privilege, every practice right, every seat at the table was earned, fought for, through the collective determination of those who came before them. It is the responsibility of our profession and the importance of advocacy to be taught both in the classroom and at a national level. It is essential that our new graduates understand that history because it defines the duty they now inherit. To my colleagues and friends at MAPA, the Maryland Association of Dermatology PAs, the SDPA, the AAPA, NCCPA, and all PA educators, volunteers, and staff, thank you for your leadership and dedication in advancing our profession, standing shoulder to shoulder and walking the walk on the front lines of professional progress. To the physicians who have treated PAs as true partners in care, thank you. And to the next generation of PAs whom I've had the honor to teach and mentor, your energy, enthusiasm, and the compassion give me confidence that the future of our profession is brighter than ever. To my daughter, Rebecca, thank you for your sacrifices, patience, and love that allowed me to pursue this lifetime mission. This award belongs as much to you as it does to me. As we look ahead, our mission remains clear. The next 50 years belongs to you, the new generation of PAs. Our work continues to change lives, one patient at a time. Lead with integrity, advocate with progress, and always remember those who paved the way. I accept this award on behalf of all who believe in the mission and the heart of the PA profession. Thank you.
All right. Well, wow. I am so moved right now and honored to really have been able to witness all of the incredible work that our colleagues here have done. And in closing remarks here, I'd like to thank all of our speakers, our panelists, our awardees. Congratulations to the awardees and every attendee, virtual and in person, for making this event come alive. Today, we've explored the legislative landscape, heard from leaders shaping policy, and witnessed the power of advocacy in action. What seems like a small act has potential for significant impact. We've also celebrated individuals who are going above and beyond to expand access to care. In terms of our theme, Bridging the Gap, it isn't just a theme, it's a call to action. So we've heard that today multiple times. I hope that some of you can take this with you today, whether you're a student, a practicing PA, an educator, an ally. that you have a role to play in shaping a more equitable and accessible healthcare system, especially in this changing landscape. Whether it's reaching out to a legislator, joining MAPPA, or advocacy efforts, mentoring a student, or simply sharing your story, your voice matters. It's how we protect our progress and push forward the future we know is possible. So let's keep showing up and speaking up and bridging that gap together. On behalf of PALLA, our MAPPA partners, thank you all for being here. Safe travels, and we look forward to continued work ahead. Have a great weekend, everyone.